Hello, I'm Allan Fels, Chair of the National Mental Health Commission, and I'm very pleased that in Australia we have Mental Health Week because that's an important way of getting the community to recognise and better understand the challenge of mental health and mental illness in our community. And it's also an opportunity to celebrate the lives of millions of persons in Australia who have mental health challenges and problems and difficulties, and how they deal with them, and how they are so well supported in many cases by families, carers, friends and the community. The Mental Health Week also enables us to renew our dedication as a community, and certainly at the National Mental Health Commission, to see that every person who experiences mental illness can lead what we call a contributing life. That is, their own life is as fulfilling as could be, that they have friends, families, connections, that they lead a life based on good health and good health care as a whole, that they have somewhere to live that is safe and secure, that they have something to do every day, whether it be a job or some kind of activity, and that as far as possible they can merge into a community which does not have discrimination or apply stigma to them in any fashion. The Mental Health Commission is dedicated to holding governments to account for their performance in dealing with mental illness. We're also dedicated to spreading the word about best practice in Australia. The fact is, there is a great deal of good things going on in mental health in the community and elsewhere, whilst there are challenges elsewhere through gaps and deficiencies in the system. And we try to keep as close an eye on this as possible and to report publicly on it. I particularly want to acknowledge the contribution made by carers and families and friends. I myself am a carer, and I know that a contribution by the family can make a big difference to the life of a person with the lived experience of mental illness, and that we should do everything in the system to encourage and support the contribution by carers, whilst recognising that a number of people with mental illness are lonely and don't have that support, and that we should be doing things to try to make up for that deficiency. I also want to acknowledge the great contribution made by the providers of mental health services in this country, whether they be non-government organisations, just groups of individuals, families and so on. And as I said, I want to particularly acknowledge the lives of people with the lived experience of mental illness. So I very much look forward to this week, Mental Health Week. It's an important week in the life of Australia. Thank you.